This year, it may take political intervention to ensure Colorado's hospitals are a safer place to work.
The demand, the lack of staff, no one has a reserve to draw on when things get tense.
From verbal threats to full-blown assault, Colleen Casper with the Colorado Nurses Association says it's a tough time to work in healthcare.
It can escalate to actual physical harm, and it's tragic for everyone involved because there's consequences.
A new bill would create violence prevention committees at healthcare facilities made up of existing staff. Facilities would develop a plan, train employees, track incidents, and offer follow-up services.
It really does amplify those workers on the ground with the patients, our first responders, and it gives them the power, the voice to make these violence prevention committees really strong.
And the examples that we hear are really distressing examples. People who are punched, kicked, spit on, verbally assaulted, abused, and all in the course of doing what they come to do every day, which is treat their patients and care for the people in their communities.
The Colorado Hospital Association says, yes, this problem is pervasive, but questions if this bill is the best way to solve it.
We are definitely for the concept, which is to find ways to protect healthcare workers. What we are evaluating is the specific provisions of the legislation to make sure that it is actually meaningful and doesn't just create new reporting requirements or duplicate requirements that are already on the books.
So the Hospital Association told us that there's actually one hospital trying something unique out in the Western Slope where they're bringing canine dogs into the ER. They can both serve as law enforcement, but also help with de-escalation, even emotional support for patients and visitors. And it's been working. This violence prevention bill, going back to this committee idea, it would extend to Colorado's hospitals, freestanding ERs, even assisted living facilities. I'm told it's been assigned to a committee, but no date yet on the calendar to formally hear it. Tom?
Well, we certainly want to see those people protected. Are they not already in many ways protected by the laws that are already on the books?
There are certainly laws on the books, but the folks at the Nursing Association told me today that punishment alone doesn't seem to really make a difference, and it's only been escalating, right, since the pandemic. So time to try something else.
All right. Thank you, Jenny.